Welcome. It's an honor to share this space with each of you to collectively explore practices that set the conditions for learning. We will first take a look at the landscape of mental wellness conditions of our youth. This will also include some information about our educators. As we know, in order for our students to be well, the adults around them need to be well. We will next explore how this is showing up in our daily practice and some of the strategies we have found helpful to move the needle forward to prevent, intervene, and provide support. And lastly, we will share a specific example of a statewide and district-wide approach to building a safe and supportive educational community to mitigate trauma and address the mental wellness of both students and educators. Let's begin our time together today exploring the landscape of mental wellness of our youth and educators. We are faced with a multitude of challenges around us: global strife and unrest, trauma, violence, natural disasters, all which add a layer of uneasiness, worry, and stress, which can influence our daily functioning. The mental wellness of our youth is a primary global concern and identified as a global health crisis. Yet, we continue to experience a plethora of barriers to mental wellness supports and services. Shortage of school-based mental health professionals such as school psychologists, school counselors, and school social workers, access to tools and strategies, and consistent policy and funding mechanisms, as well as the availability of a continuum of services from prevention, intervention, and crisis response and recovery. Over the past decade, the mental wellness of our youth has steadily declined with a significant increase in mental health challenges, including depression, anxiety, and suicidal ideation. Nationally, suicide has now risen to be the #1 cause of death for our youth. Youth who identify as LGBTQI+ are 5 times more at risk for suicide attempt, and our African American youth are twice as likely to die by suicide. Overall, 42% of our youth have reported a sense of hopelessness. 65% of our students who identify with the LGBTQI+ community. What we know is not all youth are experiencing mental health challenges. There is research that does indicate our youth, Gen Z, ages 12 to 27, are feeling optimistic about their future. These youth have excellent mental wellness and are 3 times more prepared for the future and 7 times more prepared than youth with poor mental wellness. Slightly more than half of youth reported a sense of connectedness at school. Think about the disparity here. Mental wellness is crucial to the lifelong success of our youth and society. Wouldn't we want all youth to have the fundamental experience of being a valued and connected member of their community, to feel safe and well? As human beings, we need to be well. We also need to both feel a sense of and have actual safety, both physically and psychologically, in order to connect with others, to engage in our daily lives, and to function fully in life. This was a starting point for the work we engaged in our district. Over the past few years, it's been a struggle to create safe school environments. We found ourselves, not sure if you can all relate, investing most of our resources and time into reactionary efforts and symptoms of a larger need, physical and psychological safety. With students, we experienced a significant growth in violence and behavioral needs resulting in suspensions and/or expulsions. We also were overwhelmed with a number of students experiencing stress, anxiousness, and medical issues, and a decrease in attendance, engagement, and a sense of connectedness. Nationally, 93% of our educators have reported the increase in student needs. 78% of teachers have indicated students connect with them to share their mental health needs, thus reflecting the need to foster the mental wellness literacy of all educators. We all have a role to support the mental wellness of our youth. Research has identified educators have also demonstrated higher levels of stress, limited coping skills, and burnout. More than any other profession, such as first responders, law enforcement, and medical professionals. In our district, we experienced a high level of staff burnout, and both staff and substitute shortages resulted in district leadership covering classrooms, including myself. The number of students and staff death also rose significantly over the past few years, thus overwhelming our psychological triage and crisis response and recovery team. The hopeful news is the needle is moving forward locally and nationally, with a recognition of these challenges resulting in increased community conversations, grassroots advocacy, and legislative initiatives. All youth must be afforded the conditions for positive mental wellness. So our goal was to support all members of the community to understand their role in this work and to collectively engage in order to create a comprehensive, integrated system for all members around conditions for learning, including mental wellness, connectedness, and overall physical and psychological safety. So where do you start? I know we don't have a lot of staff and a lot of money, but we started with 4 considerations. First, through our relationships, which is the foundation of this work, is creating a team of diverse voices and stakeholders, engaging our community through listening and working together collectively, designing a comprehensive integrated systemic prevention approach, and ensuring that our evidence-based practices and efforts were data-driven. So we first identified a team, a set of folks that were invested in the work of mental wellness. Our work was like that of Huckleberry Finn, trying to enlist folks to help us paint that fence by identifying the needs, fostering mental wellness literacy, providing strategies and intervention services, and crisis response as we attempted to move the needle forward for prevention and wellness promotion. Where do we start? We started with our educators. Given the workforce was overwhelmed and trying to survive, we started with a simple mantra of stop, pause, and breathe. A starting point to really take care of ourselves and just pause for a moment. We also wanted to create and foster a sense of connection around our staff. We instituted the structure of how we convene by beginning and ending each meeting with tools for mental wellness, maybe a mindful minute. We also conducted check-ins and empathy interviews to listen and engage staff and educators in informal discussions. We then next went to our student and engaged them in empathy interviews. We developed mental health clubs at each school site, and we co-designed and co-facilitated community forums and district leadership opportunities. We then brought our communities together and hosted community forums around mental wellness and suicide prevention. We co-facilitated with students and staff, parents, and over 30 local and national community partners. Rather than a sit and get, we structured meetings in a restorative listening circle format to really ensure equity. We learned from the voices of our community about the experience and the landscape of mental wellness. What were we doing to provide support and resources? What as a district should we start doing, continue, or stop doing? We also provided wellness stations to foster mental wellness literacy and access to wellness tools and strategies. The power of listening, as my mother would say, we have 2 ears and 1 mouth, thus we should listen twice as much as we're speaking. This really provided the North Star of our work, responding to the identified needs of our community. This data indicated the need to expand the conversation around mental wellness. Youth felt like we weren't comfortable or really having that opportunity as much as we needed to. And they were concerned about educator wellness and stressed out. Additionally, there have been needs around access to resources, and what we learned is students were more likely to connect through social media and virtual platforms and resources. We also designed mental wellness centers at school sites and at the district level and created spaces for comfort and well-being within classrooms. We facilitated educator wellness pop-up spaces. We embedded check-in and check-outs and opportunities to enhance connection in all community convenings, whether it's with staff or parents or students. We also fostered celebration of hope and gratitude in each community convening. We provided educational sessions and literacy around mental wellness, such as mindfulness and yoga, stress and burnout, hope and strength. and youth mental health first aid, as well as teen mental health first aid. So our adults and our students learning about their role to identify and support those with mental health challenges. We designed and provided a monthly educator wellness newsletter with access to tools and resources and professional development opportunities. It's also highlighting those folks of some of the things they're doing at their school sites. We initiated a mental health club at each school site with student district leadership and created a district leadership mental health council. We revised and created board policy around suicide prevention and intervention and postvention. We also ensured we implemented state legislative mandates. California has the most number of suicide prevention initiatives, which requires educating all staff, students, and parents in suicide prevention, ensuring ID cards for staff and students have local and national crisis numbers. We also updated our policy. We also identified a suicide prevention coordinator, and then more recently, mental health assistance posters that help kids see how physical health and mental health are connected. We envision connecting as a community, engaging the voice of students, educators, and the community to inform the threading of initiatives, resources across the district, departments, and school sites. We hope to enhance a sense of connectedness, foster mental wellness literacy, reduce stigma, and enhance the capacity of each community member to assume a role in mental wellness. This is crucial and doable, and we celebrate our success as we move the needle forward in creating safe and connected community. Thank you for being here today. It's been a pleasure, and I hope you really enjoy the rest of the conference.